A full-term pregnancy lasts around 40 weeks. Doctors and midwives will break this time up into 3 trimesters of around 3 months each. And today we will be discussing the first trimester and all the changes that happen during this period. Please don't forget to like, share, and subscribe to this channel for more content on women's health. A woman is said to be pregnant from the moment of conception, when a sperm fertilizes your egg. This is because when you conceive naturally, you usually won't know the date of conception, since you don't always know when fertilization occurs. Your egg may have been fertilized just 2 weeks ago, but because your last period was 4 weeks ago, you're officially 4 weeks pregnant at the time of your missed period. To get your estimated date of delivery, you will count 40 weeks from your previous last period. Through the first trimester, your baby goes from being a fertilized ovum to a fetus of about 6 centimeters in length at 12 weeks. During the first month of your pregnancy, a watertight sac forms around the embryo, gradually filling with fluid. This is called the amniotic sac, which helps cushion the growing embryo. There's also another type of sac called the yolk sac. The yolk sac will provide nutrients to the embryo while the placenta is developing. The fetal nervous system is one of the very first systems to develop. At about week 5 of pregnancy, the neural plate folds onto itself to form the neural tube. The neural tube is a hollow structure of tissue, which later develops into the brain and spinal cord. In the same week, the preliminary structures that will become your baby's heart begin spontaneously pulsing. Blood cells are taking shape, and circulation will begin. The tiny heart tube now beats 100 times a minute. The fetus is about the size of a grain of rice. Facial features continue to develop. Each ear begins as a little fold of skin on the sides of the head, and tiny buds that eventually grow into arms and legs form. Bone also starts to replace cartilage. By the end of the second month, the fetus is about the size of a raspberry. By the end of the third month, the fetus is fully formed, and all organs and limbs are present. The fetus is now about the size of a plum and fills your entire uterus. Since the most critical development has taken place, your chance of having a miscarriage drops after 3 months. While your first sign of pregnancy might have been a missed period, you can expect several other physical changes in the coming weeks as your body adjusts to the hormonal changes of pregnancy. Rising levels of HCG may be responsible for nausea and vomiting, which are known as morning sickness. Despite its name, morning sickness can occur any time of day. Your body experiences many changes during the first trimester. This is due to changing levels of chemicals called hormones circulating through your body. Tender, swollen breasts, mood swings, constipation, weight loss or weight gain, craving or disliking certain foods, and feeling more tired than usual. You may have only a few of these symptoms or none at all. In the early months, these feelings are normal. If you feel down or anxious, speak with your doctor or midwife, as this can be a sign of antenatal depression or anxiety. Thank you for joining us today. We hope this discussion has shed light on what to expect during the first trimester. Don't forget to stay tuned for more valuable insights and advice on your path to parenthood. Until next time.